Our next speaker, which is Dr. Daniel Ganu, is actually the co-host of the symposium. And of course, the founder, as we mentioned, of the Lifestyle Management Center in Ghana, Africa. And there is a website for you to go to and keep up with any things that are going on with that organization. Dr. Ganu has an extensive background in public health. He has earned both a master's and a doctorate degree in public health. He has served as the Vice President for Academic Administration, Director of Quality Assurance, and Academic Planning, and Director of the University Health Services at Valley View University in Ghana. Now, he's also served as the Director of Quality Assurance, the Coordinator for the MPH program, and Dean of the School of Postgraduate Studies at the Adventist University of Africa. He is the Principal Investigator for the African Health Study and Editor-in-Chief for the Pan-Africa Journal of Health and Environmental Science. Now, he's also published several articles in international peer-reviewed journals. Now, I first encountered Dr. Ganu while watching a podcast on Dr. Neil Barnard's Physicians Committee platform last year. Dr. Ganu was being interviewed on the podcast regarding his remarkable recovery from the painful and debilitating effects of rheumatoid arthritis by eating nutritionally healing foods that were found, the podcast was actually found by his wife. And so during that interview, he spoke of his newfound passion to increase the awareness of nutrition and lifestyle management as a means of preventing and treating non-communicable diseases. And at that time, he discussed his vision to launch this lifestyle management center in Ghana, Africa, to provide information, education, and resources to help the people of Ghana to use nutritional and lifestyle protocols to prevent and treat non-communicable diseases and live healthier lives. At that time, he spoke of his desire for the center to serve as a model of excellence and influence of nutritional lifestyle healing methodologies for the African community as a whole. And as I was watching this podcast, I was personally inspired by his vision for the center and reached out to him to see, how can I be of help? What can I do to be of service? And as a result, I decided that my Rollback Diabetes platform would sponsor this international symposium event to help launch the Lifestyle Management Center. So I am so honored to be here today and to introduce the founder of the Lifestyle Management Center, Dr. Daniel Ganu.
Thank you very much, Marti. Please allow me to share my screen. Give me a minute. Yeah, right there. Okay. Thank you. Thank you very much. Good afternoon, good day to all of you, wherever you are. I personally would like to take this time to thank our facilitators first for their time of sacrifice and professional and scientific presentations for the two-day health symposium. I believe it has been a journey worth taking. A big thank you also to Marti, as she is narrating, or as she has narrated, she has been a huge part of success of this journey. I one day received an email from my mailbox after that podcast, and the rest is history. As we are, watching and hearing from many facilitators now. Marti, thank you so much. And a big thank you to to the technical team, Tamika and Stephen, and especially for you, our wonderful participants. You have been a great participant. Thank you for spending your time with us during this two-day journey. We are making a history today by launching a model center of lifestyle influence, center of influence for lifestyle management one of its kinds in the continent of Africa. Let me begin this on a personal note. The dream of establishing this center resulted from a personal health testimony that started in the year 2000. I developed a very severe form of rheumatoid arthritis, an autoimmune disease, when I was pursuing my master's degree in public health. As a result of this disease, my health continued to worsen, and I was put on several medications, including powerful steroids. The pain was unbearable, and I was losing my health gradually. It came to a time when I could not even lift a piece of paper. That was how painful my joints were. I was even diagnosed later with systemic lupus, but I kept managing the condition with medication. And my doctor said that this was how it will be for me for the rest of my life. I'm going to be on medication for the rest of my life. And I could see my health wasting away. The side effects were becoming so pronounced, and I thought there was nothing I could do. It was a moment that was very difficult for me. This continued until my wife chanced on a podcast interview of a medical doctor by the physician committee who had the same condition but overcame it with a plant-based diet. And there is no way I will narrate this story by leaving out my wife. She became so concerned that she was looking for solutions everywhere. And because of her effort, she found this podcast. And then she came to me and said, I found a solution. And I said, what was the solution? She said, watch this podcast. And we watch it together. And so we decided to experiment this plant-based diet about 2 years ago, almost 2 years ago. And within 6 months, the pain in my joint drastically subsided. I started getting off my medications slowly, and the pain continued to diminish. I say it with gladness and with pride that today I am almost off all my medication, and I feel energized with no pain as I ponder over my experience. The exact question that came to my mind, or that came to me, was, why should we suffer when we have sure natural remedies that can prevent or reduce the negative effect of these chronic conditions? You will realize that the remedies for these chronic conditions, as we have heard for these 2 days, are freely available and are inexpensive. They are very powerful. They are evidence-based, scientifically researched, and they are available to us. Our beloved continent, Africa, is on a time bomb. Time bomb because if we look at the conditions or the status of our continent, the low and middle income country, we are becoming like the affluent society. And so it is time to turn and focus on Africa. Africa, home to 54 low and middle income countries, will have the world's largest increase in non-communicable diseases, death over the next decade. This is huge. Diabetes, cardiovascular diseases, cancer, and chronic respiratory diseases They all fall in the category of non-communicable diseases. They are often referred to as lifestyle diseases. We call them diseases of civilization, or we also refer to them as diseases of the affluent community. These diseases are largely linked to how we live our lives and the environmental factors surrounding us. Currently, the statistics has it that currently 24 million adults are living with diabetes in Africa, and the figure is projected to rise by 129% to 55 million by 2045. It is really a time bomb. In the African region, the life expectancy for Africa in 2022 was 63.82%. And then it continued to increase. Africa's age standardized death rate for diabetes is 48% per 100,000 population, more than double the global rate of 23 per 100. All these statistics came from WHO. Non-communicable diseases are now the leading cause of death in most regions of the world, accounting for up to 70% of all death worldwide. So non-communicable diseases are here with us and are causing a lot of havoc. To some people ignorantly, and to some people we just need some motivation to be able to overcome these conditions. In Africa, non-communicable diseases are rising rapidly and are projected to exceed communicable, maternal, perinatal, and nutritional diseases as the most common causes of death by the year 2030. In addition, the rise in NCDs has created multiple burdens of disease for already overstretched health system in Africa, where we still have communicable diseases such as malaria, tuberculosis, HIVs, and then we also have poor maternal and child health. They remain major problem. More so, treating people with non-communicable diseases is complex. It involved advanced diagnostics and drugs, as well as intensive disability management and prolonged cure. Benjamin Franklin said in 1736 that an ounce of prevention is better than a pound of cure. What it means is that it is better to stop something bad from happening than it is to deal with it after it has happened. You and I know that prevention is the best way to go. So what is the way forward? As a result of this, we think that establishing a model center of influence for lifestyle management will help all of us, or will help the continent of Africa to provide health education and resources on the integrative application of nutrition and lifestyle protocols in dealing with chronic diseases. We have learned a lot during these 2 days. Nutrition is a key to reversing and managing and preventing most of these lifestyle or chronic diseases. Number 2, the Lifestyle Management Center will serve as a prototype for lifestyle center throughout the African continent. In fact, what we are planning to establish will serve as a prototype for lifestyle centers throughout the continent. And then it will leave a legacy of generation health in the African continent. So the purpose of this symposium, this 2-day symposium, is to, one, increase the awareness of nutritional healing, as we have learned today in Ghana and across the continent of Africa. Number two, share dietary and lifestyle approaches to manage and reverse chronic diseases. And number three, help launch a lifestyle management center in Ghana. And that is the purpose of putting together these 2 days symposium. Today, we are launching the Center of Influence for Lifestyle Management and Research, which is a history making in the process, a center of influence for lifestyle management and research. The Center of Influence for Lifestyle Management and Research is envisioned to have the following elements. Number one, we will have a shop for organic product in the center. Nowadays, we have many products that we don't even know whether they are genetic modified food or processed, or many kinds of products surrounding us. But we know that organic products are the best for us. And we will also have vegetarian restaurants in the center. We will have vegetarian cooking school. Many people, due to lack of knowledge, may not know how to manage well vegetarian diet, and we are preaching. And if we are not careful, we will tell them plant-based diet is the best, but we will not let them know how to practice it. So we will have a vegetarian cooking center unit in the center. Number three, we will have a state-of-the-art gym. And then number four, we will also have lifestyle management unit in the center. And then number six, we will have elderly care home. Number seven, there will be a research unit, an evidence-based research unit. And the last one, there will be a conference hall. Now, each element of the center, these 8 elements, each of them will be introduced gradually in phases as and when it becomes practical. It will indeed be a model center of influence for lifestyle management for the continent. And here we need your support. We really need your support. The center is registered already as a not-for-profit organization with a mandate to operate in Ghana. We have the certificate to operate already. Our mission is we would like to develop realistic actions to prevent illness, promote self-care, and increase healthy behaviors. We have come to a point where we need to take responsibility of our own health. And the vision is to become or to be a premier center of influence for preventive medicine and research in Africa. We can. It may seem an ambitious task, but we can. We can do it. Africa, we need to have something to show. You know, there are 5 regions where we have the green zone, the blue zones. US, because of Loma Linda University, that region is tagged as one of the green zones. But Africa, what do we have to show? We need to show something. This will indeed be a unique center that will educate and create awareness. Number 2, it will advocate for lifestyle modification. And then it will be a scientific and evidence, it will serve as a scientific and evidence-based research center. And then lastly, it will serve as a center that will manage and reverse chronic diseases. Plan for the center, or plan to launch the center. First of all, we will have a pre-planning stage. That is where we are now. We started with Health Symposium to launch the center, and that is what we are doing now. After today, we are going to go into the second phase, which is fundraising. We will need a lot of money to set up this center and to make it a customized center. From the beginning, we will need to do the drawing and help build this center from the scratch to where we want it to be. We don't want to go and rent a building somewhere. No, we would like to begin it from the scratch. So we will seek donations, and that will probably take us about 1 year. After that, we will now design the building. We will seek approvals from various governmental organizations and put up infrastructures, the infrastructure in phases, according to the element, the 8 elements in the center. That is the third phase. The fourth phase is acquisitions. We will acquire the materials needed, and then we will set up the center for business. And then the fifth phase is the center will now start operations. So let's look at our timeline. February 2023, which is the pre-planning stage, is the health symposium launching. Thank God we have fulfilled that timeline. So we are ending today. We are launching the center today. After that, we are moving into the fundraising, seeking donation. That will begin from February 2023, and by February 2024, we are sure that we will raise the needed money to be able to start the building. Then from March to December 2024, we will now begin with designs and building. We can build we can design a building for one of the elements. And so we will do it in phases, seeking approvals and putting up infrastructure in phases. So we are giving ourselves March to December 2024. Then from January to August 2025, we will acquire all the materials that we will need to set up the center for business. And then we believe that by September 2025, the center will be in operation. We want to stick to this timeline, and we will need your prayers. So we would like to thank you so much. You can reach us through this email address. You can take a picture, and this is our website, and our phone number is there, which is also a WhatsApp number. We would like to hear from you, and then we will also reach out to you in due time when the fundraising begins. I would like to thank you so much for listening, and thank you for attending this symposium, making it a great success. And then I'll pause here, and then if we have any question and answer, we will welcome it. Thank you so much.
Okay. I do want to, I do have a couple of questions. Dr. Ganu, when you look at the time frame for getting the symposium put together, and by the way, I'm just so, I guess, inspired as well as excited about what you are going to do. And by the comments on the chat, there are people that are here that are just as excited. One person I just saw said something about, great, now I can be a health evangelist. Finally, this is my dream come true, to become the health evangelist. So my question is, from the people that are on the attendance right now, what can they do with regards to getting the information out, perhaps, or maybe creating a think tank, or coming up with creative ways to fundraise? Because there's the GoFundMe pages. There's also there's a phrase that says a lot of people doing a little leads to great success. So when I look at how Obama here in the United States became president with small donations, that was unheard of, but because of the internet, he was able to seek $5 and $10 from a lot of different people. I just put that out there to kind of get the ideas started on how you can go and put together a strategy, a plan to actually, start to raise money. And I wanted people on the chat, if they have any creative ideas, also just to share that.
Thank you so much, Marti. I believe that with the help of all of us here present, we can have this dream come true, and it is true. If we believe that and we want to support this dream, we all have a part to play. A little contribution from each one of us, not necessarily from you, but linking us to people, and then taking us to where probably we can find help will be a great help for us to have this dream come true. And I agree with you that the internet is a great tool we can use to be able to raise these funds.
Do you think that you also need any assistance with labor? And what I mean by that is there are people that have skill sets, whether it's with regards to the actual, design or the putting it together, or maybe marketing skills, or maybe, I don't know. There's people out there that have so many different types of skill sets that maybe they can come and actually help you. Do you need any of that kind of help at all?
We definitely need this help. And that is why I don't know if I can put, I will put my, or maybe Tamika, you can put my, the email address, the telephone number of the contact of each of us. If you think you can donate your expertise, you can help in any way, you can reach out to us and we will be very grateful to you. You can become part of the team to be able to carry this through. So definitely, Marti, we will need help, a lot of help.
You also, I think, had in your proposal, I don't know if you had it on this presentation, the cost, the expected cost. Did you include that at all?
No, I didn't include, since today is not fundraising, I didn't include it in the presentation, but we will need about $1 million to begin with. $1 million to begin with, to be able to design, seek approvals, and then put up the infrastructure, but not to furnish all of them, because we want to begin the element in phases. But we will put all the infrastructure and then maybe develop one and begin operation with it. And then when it becomes practicable, we will move on to the second element, the third element, until we have all the 8 elements. So we will need about $1 million to, for a start.
Okay. So people know that you can go to the website. There is a donate button. I'm going to say it. I know you don't want to say it, but there is a donate button there. And again, what we could do is at least get it started to kind of sometimes just getting the energy going. There's a spiritual component to that, as we start to do things, we start to do more things. But one of the things I wanted to ask is that someone made a comment that I thought was pretty interesting. They said that there's a suggestion to have credible ambassadors of this project in each country, which would be having regular meetings, updating on progress made, and basically being able to also tie into different skill sets, perhaps in that area, which again, I think is an interesting suggestion. What are your thoughts on that?
Yes, I mean, that's an incredible suggestion, and we will need volunteers. We may not know who is interested, who would like to volunteer his or her time. So if you are somebody right here, you are interested, you would like to be the ambassador of this project in your country, Tamika, I believe you have posted the email address and the phone numbers there. Please reach out to us, and then definitely we will keep updating on our website. We will keep updating people. So feel free to give us your name and your suggestions if you want to be a volunteer and to promote these in wherever you are. We will appreciate that very much.
Okay, and that was Olivia mentioned. She also mentioned something else. She says, worthy replicating in other countries, as Senior White puts it, have sanitarians in the country to serve the cities too. What does that refer to? Have sanitarians in the country to serve the cities too?
Yes, sanitarium is, the Seventh-day Adventist Church began with a health message, and the health message is termed or is supposed to be a sanitarium. Sanitarium is where it's not so much about clinical treatment. The clinical is there, but we attach health education where natural remedies are used to treat people. And you may not know because you are not a Seventh-day Adventist. We have the proponents of this health message, Ellen G. White, who really proposed that our health centers should be sanitarium. Sanitarium is where, like I said, natural remedies are used to treat people. And that is what we are coming back today. And she proposed this in 1863, and now we are coming back to it today, that it is one of the ways we can prevent and reverse chronic diseases.
Great. I do want to, go ahead, Tamika, I'm sorry.
Well, I was going to say there was a question of, is this a private work or is it under the Seventh-day Adventist Church? And they said in Southern Africa, lifestyle centers have been there for a long time, but they have not gotten the expected support because they are private efforts. So experience sharing may help as well.
Yes, that is very true. For now, we don't want to start it with the church. Eventually, maybe with time, the church can come in. Some of these organizations, there are politics and all these things going on, and we want to move and follow our timeline. We don't want bureaucracy and all these things. So we will keep it as it is now. It's a private venture, but eventually, maybe in the future, when it is running and well equipped, we can think of what and the other way to do it. But for now, it is a non-for-profit organization.
You have people on the chat that are from Ghana, as you know, people that have participated.
Exactly.
And they basically said, look, you can count on us. So we want to make sure that, we definitely take advantage of that and do that. And also someone mentioned applying for grants within the church and other philanthropy types of organizations. So Tamika, there was a question that Andrea asked earlier about why the rise. I think that was during Dr. Ganu's presentation, or maybe after Dr. Barnard. But basically, Dr. Ganu, do you find that, I know that we do have a rise of fast foods. I mean, that's and a lot rise of fatty foods. The Western foods are coming over to your side. Do you find that there's a lot of that going on in Ghana too, or do you still have a lot of a lot of the gardens and things like that?
Marti, I just have to be very blunt here. The Western lifestyle is very influential, and I don't want to say very domineering, but people like to copy the Western lifestyle. And so we copy everything. Your
don't
food.
Do that.
So when I was a child, I'm not so old, but when I was a child, I have never seen Western food like Kentucky Fried Chickens and all these things, Big Mac. But now today, if you go to the city of Accra, they are everywhere. They are everywhere. Come to Kenya here, where I am right now, they are everywhere. I have traveled to many African countries, they are there. And the way they market it to you, that is what we are saying, that they are really catching the attention of our youth. and the taste is such that if you are hooked to it, you become addicted. And so they are there. The Western lives, disease, food are there, plenty.
Okay.
Yeah.
Take the good and discard the bad. Don't take all the good, the stuff here.
Yes. So beginning maybe within the week or early next week, we will come up with the strategies for fundraising, and then we give ourselves 1 year and see what we can do with it.
And it is going to be, and I know you mentioned it is going to be in the center of Accra, Ghana, the actual
Yes,
building.
it's going to be in Accra, a suburb. Actually, we want it to be in a serene environment, serene place, a little bit away from the pollution and the noise and all this. And so we want it to be in a place where there are a lot of trees, and where people can feel that they are in nature.
Okay.
Oh, Dr. Ganu, somebody asked, would there be training of health evangelists as they're already doing, but they need special training?
Health evangelists. Yeah, if you look at the elements in the center, the health evangelists will fit into vegetarian cooking school, but the training, it will not be a training school for health evangelists. Of course, it will be a center of influence. People need to come there and see some of these life-changing practices, lifestyle modification practices. And we can attach we can attach it and make it one of the elements of the center where health evangelists are trained, but there will be no school whereby we give a degree. No, it is totally lifestyle management center.
But you know what it does actually, when you have these opportunities, it can bring people with ideas can actually start, something like that. So in other words, it could be an arm that someone decides to start to spread the word about nutrition, and then link up to your organization. So I think that there's so many different ways to develop a foundation of good nutritional living, and there can be different arms of it. So I just wanted anybody that has that kind of entrepreneurial spirit or has creativity, there's so much that needs to be done around the world and in Africa that we just have to have people that are willing to take their ideas and turn them into a reality.
And
Perfect.
Another question was, is the place in Accra already decided and acquired?
Yeah, we have identified about 2 or 3 places, but then we're also looking at a land. We want to purchase a big land that people can even take a walk. So we have identified basically 2 places. One of them is high on the radar that we are working towards.
Okay. Well, I think we might have.
I think we just had another comment though, and it goes back to the marketing that the marketing of fast food, of course, those commercials that come at you day in and day out. I know they're here in the States, and I'm sure they're over there. And they're usually sponsored by pharmaceutical and food companies. That influences us, and it is very detrimental. It's like when we sit at the TV and we listen to all the commercials coming at us, or we look on our phone and there's all these different ads that are coming at us. We have to kind of guard our spirit, because it will seep into our soul, and that is what we will end up doing, not recognizing that we're being controlled by that influence. So I just want to be mindful of that. And I think, again, the more we become aware, the more we claim our health, we take control of who we are. And then the bottom line is this: we got to rethink what food is. There was a time when we ate because we knew it was nutritionally healthy for us and it was for energy. But now we eat just to be eating, not recognizing that what we're eating is not real food. So I'm gonna get off my soapbox, but I just think that it's so important to understand that the powers that be that are making tons of money are wanting us not to recognize what's happening, so that we just kind of go lock and step and basically walk like a duck.
Yeah. Okay, that's true. That's true.
I know there's been
If
some.
we are done, go ahead.
Now, I was just going to say that this has been a great symposium, a great event, great virtual event. And some people are asking if there's going to be plans for a physical meeting in the future. So.
Yeah, it's possible. It's possible. We can. One thing I know for sure we can do is to organize these once every year, and I realize that people have taken interest in it, and so but the physical part of it, it's possible. We can discuss it, and I think yes, we can do it. And it's probably when we are about to start the operation of the center, we can now all go to Ghana and begin maybe a 2-day symposium to be able to open the center.
Great. And then another question was, is there an account in Ghana to contribute to my Windows Mite?
Yes.
Okay.
We would, if you go to our website, we have a button you can click and you can donate through online. You can donate through M-Pesa. You can donate through Momo. Momo is a way of donating through mobile phone in Ghana. You can donate with a check. You can donate, and so visit the website and you will find various ways of donations that are available for you, and you can also reach out to us.
Okay. Awesome.
So with these discussions, if there are no more questions, may I now take this opportunity to...
Doctor, I think there's one more. I'm sorry, it snuck in on us. They said we already have a registered certified health life wellness counselors and educator training in Eswatini through one of our ASI Private Health Life Institute. Change agents are truly needed for this massive awareness need.
Yes, I believe it's a comment. That is true. I agree with that. I agree with that.
Okay. All right. Thank you, sir.
May I therefore take this opportunity to duly launch the center? So maybe we can give a clap and we can give an electronic hand to ensure that the center has been launched today. Okay, thank you, thank you. Thank you, everybody. Okay, back to you, Marti, our host.
Okay. Dr. Ganu, as always, that was awesome. And let's see if can you see my video? Let's see here. Okay. Okay, so that was great. I think that you did what you set out to do with this symposium and also sharing this information with us. I am so honored to have been a part. I think the team has been awesome. The audience participation has been amazing. And so we're just going to keep it moving. We're going to keep it moving forward. And we're going to definitely pray that we continue to help with your vision, that the audience members continue to stay connected to your website. And we'll just keep this journey moving forward in the best way, because it's all about our health. It's all about everybody's health, right? And generational, our children and their children's children. So with that, we're going to go ahead and close it out, unless you have something else to say, and then we'll just keep people connected to what the center is going to be doing. I know it's going to be amazing. And so we thank you for that.
Thank you. And I would like to thank you and the team, the rest of the team members, for a wonderful work done. Great symposium. Thank you.
Great. You all have a wonderful rest of the day, and thank you all for sharing this with us.